Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through October 27th, 2021. I'm going to continue what I've been doing, and that is try to give a quick update. This is today in 3 minutes, so I'm going to start my timer as soon as I can. Here we go. So I'm going to tell you the things that I think are important from the past week. First, obviously, the CDC has recommended booster shots for those who received the mRNA vaccine, Pfizer or Moderna. If it's been 6 months since the completion, you're 65 or older, you have chronic conditions, or you're at high risk of exposure because of your employment, they're recommending that you get a booster. If you received the J&J vaccine, if it's been 2 months since vaccination, all adults, regardless of risk factor, are eligible for a booster shot. And the CDC is saying that based on the data they have now, it's probably okay to mix and match. If you got one type of vaccine, you can get the other as a booster. They're not saying it's better, but it's okay. The second thing that's happened this week is the FDA Advisory Committee has recommended the approval of the vaccine for children over 5. Now, by the time you see this, the FDA may have approved it itself, but at this point, it's just a recommendation. But this does raise a question that some people have had, which is why is the CDC making recommendations? Why is FDA making recommendations? Well, the FDA approves a product for marketing. They say it's safe and effective for its labeled indication. Once it's approved, physicians can generally use it as appropriate, but the company can't market it for an off-label indication. So when the FDA says it's okay to use it in children over 5, that means that the company can help go out and market it. The CDC, on the other hand, recommends how it can be used. What makes it a little more complicated is that both use advisory committees. So the CDC uses the Advisory Committee on Immunization Practices, the ACIP. The FDA uses the Vaccine and Related Biological Product Advisory Committee. The ACIP is generally considered official CDC recommendations. So when they recommend something, it is official. Whereas the FDA usually, but doesn't always go along with the recommendation. The third point from the last week is the U.S. has now passed 750,000 deaths from COVID-19. It's reduced our life expectancy by over a year. Last year, it was the third leading cause of death in our country after heart disease and cancer. And as I've pointed out many, many times, where it doesn't all happen at one time. You remember a few weeks ago, it was down here in the Southeast, all the cases. Now they're up here in the Midwest. That's the same pattern we saw last year. Now, whether we're going to continue to see that pattern or not is uncertain. But just because it's not affecting your area doesn't mean it may not happen again there in the future. And finally, not surprisingly, there's a new variant euphemistically called the Delta Plus or AY4.2. It's occurring in England. As of this morning, I saw about 10% of the cases there. It's unclear if it causes worse disease. Remember, for a variant to be important, it can be more transmissible, more lethal, or it can evade our immune system more effectively. So those are the points I wanted to make in 3 minutes. I'm going to stop my timer. The CDC has now recommended booster shots. The FDA Advisory Committee has recommended approval of the Pfizer vaccine specifically for children over 5. The U.S. has now passed 750,000 deaths from COVID, and there, not surprisingly, are new variants as there will continue to be. A great deal more information about COVID-19 on the College of Public Health website. If you're sharing this information with others and they'd like to be added to the website, please let us know. As always, thanks to Dara Young for editing, producing, and posting this video. If you have any questions about COVID-19 or about what I've said today, please let me know. I look forward to hearing from you. Thank you very much, and be well.